Hello, I'm Dr. Shane Shapiro, consultant in orthopedic surgery from Mayo Clinic in Florida. We're here live at the Mayo Symposium for Regenerative Medicine in Scottsdale, Arizona, right around the corner from Mayo Clinic in Arizona. And we're having a great meeting. It's a multidisciplinary meeting where we have our specialists from all over Mayo Clinic at all three sites, as well as scientists from other institutions to discuss hot topics and trends advancing the field in regenerative medicine. So in Mayo Clinic in Florida, we have opened regenerative medicine therapy suites where we can take the scientific advances that we have had over the past couple of years in regenerative medicine and translate them into procedures that are currently available for our patients. Those are procedures that are available clinically right now, as well as procedures that we are still investigating from a scientific standpoint in clinical research studies. We're very excited about the offerings in our regenerative medicine therapy suites. These suites were created as a hybrid type of procedure room that is completely different from where we would be evaluating patients in clinics, but also different from the operating room. So we've taken the best parts of the operating room and the comfort of a clinical procedure room setting, and we've combined those elements together to make a very nice environment for patients to come and have these minimally invasive procedures performed while hopefully avoiding the complexity of the operating room. Some of the procedures that we have been working on include things like platelet-rich plasma for joint pain and arthritis, also platelet-rich plasma for chronic tendon and ligament problems. We have expanded from our platelet-rich plasma offerings in orthopedics to stem cell-based options in joint disorders, and we're doing some of those stem cell procedures as part of the clinical practice, but also as part of research. And the procedure suites are not just for orthopedic surgery. We're also using them as part of our dermatology and plastic surgery practices. And we've even done some wound care, some chronic wound care with regenerative therapies in those procedure suites.
That's great. Can you tell us a little bit more about who might benefit from these procedures?
Well, normally when we consult with patients and we have a regenerative medicine consult service where patients who might be candidates for these procedures can come in and discuss their options. Typically that discussion centers around conventional therapy or the standard of care for their particular problem. But for a number of reasons, patients may not be candidates for standard medical therapy, or they may have already had standard medical therapy and have not done quite as well as we would like them to do and may be exploring other options. These tend to be the best candidates for regenerative medicine therapies, the ones where we've already explored the conventional medical options and now we need to move on to something quite possibly more advanced.
Thank you. And if you're just joining us, we are here live from the Mayo Clinic Center for Regenerative Medicine Symposium with Dr. Shapiro. Dr. Shapiro, can you tell us a little bit more about at what point in treatment somebody might consider a regenerative medicine therapy? Is this in lieu of or in addition to?
Well, it really could be both. And you know, the exciting thing about regenerative medicine is it's really a new field. And so we don't yet have all the answers to our questions about who, what, where, why, and when it comes to regenerative medicine. We're working on those things, and we hope to be able one day to know exactly when we should be applying these novel therapies and when they might work and when they won't work. But we're not quite there yet, and so really what we're doing is we're helping patients explore their options. If there is a simple medical solution to a patient's problem, or if there's a simple therapeutic solution, like sometimes for musculoskeletal problems, A short course of physical therapy is all the patient needs, and we don't need the complexity of a regenerative medicine procedure. And it's always the case when we speak to patients, if we have a simple medical therapy, even a simple surgical therapy that would be the answer to their clinical situation, that's always the one that we're going to choose first. But when it comes to the more complex problems or problems where we've already failed conventional therapy, then we offer these regenerative medicine services to the patient, try our best to educate the patient about what's involved with these regenerative medicine procedures, how we've studied them, how we think they can help, and if that's something that the patient is interested in pursuing, then we'll go down that path together.
Thank you. Elizabeth asks if this is appropriate for fibromyalgia.
Well, we haven't yet come up with any interventional strategies for fibromyalgia. And right now we do have a lot of great services for patients with fibromyalgia at Mayo Clinic, but most of them are multidisciplinary services that revolve around therapies and medication. We don't yet have interventional-based strategies for fibromyalgia, but it's such a difficult problem. You can bet that scientists and clinicians who specialize in studying fibromyalgia will soon be working on that.
We have a few other questions. They ask, what about rheumatoid arthritis? Is this an option?
Yeah, I think it might be. We haven't made rheumatoid arthritis the focus of our regenerative injection-based therapies. We've started mostly with degenerative joint disease, but I have had a number of patients with rheumatoid arthritis and with other inflammatory joint conditions come to us seeking these procedures, and a number of them have chosen to trial the injection therapies for rheumatoid arthritis. Some of them have done quite well, but I would stop short of saying that we know exactly what's involved with how these injection therapies work for rheumatoid arthritis. Again, it may be something that might be a nice adjunct in addition to the medical therapies they're already receiving for rheumatoid arthritis. But all patients should consult a specialist in that particular area, a rheumatologist who specializes in rheumatoid arthritis, to discuss whether or not these type of injection therapies could possibly be helpful. And again, we hope to learn much more about how patients respond to these injection therapies in rheumatoid arthritis at some point in the future.
Thank you. Another question, have you used this, or can this be used for cardiac patients who are trying to avoid bypass?
So our cardiology research in regenerative medicine is ongoing, and it's an area of rapid discovery, and our scientists in Rochester and in Florida and in Arizona are all working on cardiac applications to stem cell and cell-based therapies. That's a complex type of procedure that probably is not suited for our regenerative medicine therapy suites, where we don't have all the niceties of the operating rooms, where sometimes those procedures might need to take place, or in a suite, a cardiac suite, where some of those surgeries are performed. I think that we will be applying regenerative medicine and cell therapies in that setting in the future. They're just not going to be happening in our regenerative medicine therapy suites.
Thank you. All right, we're going to take our two final questions. The first question is, can this be helpful to patients with EDS, Ehlers-Danlos syndrome, and ALS?
Well, again, great questions. The second one, ALS, we are studying stem cell therapy in ALS, and Dr. Windebank in Rochester and others in the Human Cell Therapy Lab in Rochester have actively studied stem cell therapy for ALS. So we were very excited about that. still have a lot to learn, but that is ongoing. As for Ehlers-Danlos, I'm going to have to admit that I have not yet looked into what kind of cell-based therapies are available for Ehlers-Danlos. We certainly see patients with Ehlers-Danlos from time to time, and we know that from a joint perspective and from a muscle perspective, it can be a very difficult problem to treat, but I have not yet thought about what kind of cell-based therapies might be available for that condition. So that's a great question, and one that we need to start thinking about.
Thank you. And just generally, does insurance generally cover these procedures?
Oh, that's a great question. Some of the regenerative medicine procedures that we are currently doing in the regenerative medicine therapy suites are well-established medical procedures, some of which are even cell-based, and those procedures, especially the ones we're doing for chronic wounds, do have insurance-based coverage. A couple of the other tendon procedures that we are doing are starting to pick up insurance coverage. A couple of the other more advanced procedures, especially our stem cell procedures, don't yet have insurance coverage, so that is a problem for us and for some patients. But what we're doing in response to that is we're trying very hard in our research and in the regenerative medicine therapy suites to come up with ways to manufacture these products at a much cheaper level, and when we can drive the cost of these procedures down, then they will be available to more people. And of course, as we produce the scientific evidence needed to support these procedures, we'll be able to get the attention of the insurance companies and show that some of these might be able to prevent more costly surgical procedures. And so in lieu of the surgery, if we can have a much more inexpensive cellular-based therapies, we would expect that the insurance companies would come around and start covering these for our patients.
Great. Well, doctor, thank you so much for joining us
you.
today.